Okay, so Jeremy, again, thanks. We just got done talking for an hour on the audio portion, and I wanted to save something just for YouTube listeners. And I actually just got done. Some of you may not know this, but I am pursuing my doctorate degree in educational psychology, and so I just got done with a substance abuse class that that addressed alternative treatments in the mental health world, and primarily they talked about cannabis, MDNA, which is ecstasy, and ashwagandha. I might be saying that incorrectly, but yeah, there you go. And one of those, I believe that the latter was one that has them. Oh, and this one I actually didn't put in the notes, and you don't have to answer if you don't want. But the electrical stimulation treatment that is showing some great promise with major depressive disorder. But that's just a side note as another alternative treatment. But can you talk to us? Cannabis kind of makes sense to me. We've got, natural receptors in our body for cannabinoids, and what are your thoughts on, particularly for PTSD, if you live in a state, and I do, where you can have a medical marijuana card? What are your thoughts on using it to treat things like PTSD, anxiety, insomnia, all the things?
That's a great question. So my thoughts are proceed with caution on anything you do. And that is not just with cannabis. That is with any drug, drug meaning things like Xanax can be abused, right? Prescription drugs. So PTSD and cannabis, like there's emerging research on it for sure. So people who or outpatient individuals with PTSD in a study were given 5 milligrams of THC twice daily. And their nightmare frequency, hyperarousal symptoms, overall symptom severity significantly improved in a study on that. However, that the authors of the study, and I can link to this really awesome research that I'm going from here. The document itself is called The Efficacy of Psychedelic Assisted Therapy in Managing Post-Traumatic Stress Disorder, A New Frontier, ? It's from 2022, from fall 2022. So that's pretty breaking as far as research goes. But so you're hearing those symptoms of nightmares and hyperarousal reducing. So awesome, right? Well, yes. And here's my issue, my main issue with cannabis, okay? So the lethargy, you can get very fatigued. Okay, so someone already deals with fatigue as part of PTSD, which is a thing, or with depressive symptoms with that, you could be amping that up. So disorientation is a thing. You can feel unsafe from that with PTSD, because that's the opposite of being hyper aroused, hypervigilant. So anxiety is a massive risk with cannabis use if it's higher doses. Okay, you can get anxious from that, and that can be the exact opposite of what you want for PTSD. So, and this is really big to think about. There's been some studies that have shown that teens who engage in cannabis use have significantly reduced cognitive function compared to people who didn't use cannabis as teenagers and young adults under their mid-20s. And so it's, again, like anything else. So I'm sure that if teens have used Xanax, that would have some impact. I'm not sure, but I would have
Ritalin.
Yeah. Well, so the use of Ritalin for ADHD is something I'll go along with for sure, because if someone legitimately has ADHD, that's indicated, that kind of drug. But I will say that drug abuse of any kind as a teen is a very fraught territory, because it can decrease your cognitive functioning. And so also, and this is not a fun fact, a lot of this stuff isn't fun, but if you are at risk for a psychotic illness, okay, so what does that mean? Schizophrenia, and that runs in your family. You know someone in your family that has it, and you're a regular cannabis user, you're rolling the dice that will come out in you, that you will develop a psychotic illness. Don't take my word for it. There's research out there saying that. So cannabis is a proceed with caution kind of thing. It's up to in these states where it's legal, it's certainly up to the client to be well educated on it, to say, I'm going to take I can't, because by the way, sleep deprivation leads to mental health concerns, to put it very mildly. So if your doctor is forward thinking and trying to give you some sort of intervention to help you overcome that and sleep better, and he or she's decided, you know what, this is the way to go, low dose cannabis, then that's what your doctor's decided, right? But on the other end, I just talked about some very real risks, a lot of the time for teens, of things that can happen. So proceed with caution, be an informed patient. That is always the best way to go.
Yeah. That's fascinating. And you're right. I had not thought about, and that's why I wanted you to answer the question, because it's easy for those of us with PTSD. If somebody would come to us and go, hey, here's some marijuana and it's illegal and it's going to help you.
Right.
Yeah, I can see the slippery slope too, right? Because most of us have, I don't want to say have addictive personalities, but most of us are looking, we've spent a good majority of our lives looking for things to stop the pain. And so here's a legal, amount of THC, and I can totally see the downside of that. I do know that some people have quite a bit of success with it. I'm fascinated. I would never do it because I would be terrified, but there is some research out there on MDNA, which is ecstasy, on particularly trauma treatments. And can you tell us about that? I mean, there's a billion things to be concerned with in that. I mean, this is a drug that changes actually alters your brain chemistry. And so if we're proceeding with caution with cannabis, it should be a giant red flag. There's sharks and gators and everything out in the ocean. When you talk about something like MDNA, needs to be an extreme case. But why does it work, or does it work in these cases?
I may shock you with this. I think if someone gives you a joint or gives you some pot that could be laced with something and doesn't know where that comes from, I'm a little more frightened of that, of someone having an unmonitored marijuana experience with something that they don't know, versus going into an MDMA study and doing that with a psychiatrist, because that's very researched. That's something where there's ongoing studies. So MDMA was known as a party drug in the 80s. Okay. So it's, again, you brought it up, MDMA, known as Molly, right? It's the active element in ecstasy. And it actually has the capacity to decrease amygdala activity. Again, what we talk about when we talk about a fear and anxiety center. And it increases activity in the frontal lobe, the frontal cortex, which is where a higher level thinking is and decision making. So, fun fact, people with PTSD often have impaired frontal lobe, frontal cortex activity. So that can explain some deficits in decision making and being driven more by emotion. And so that's a massively beneficial thing. And a lot of the people will be given this drug and observed, right? Again, so doses of this and observed inpatient, meaning just in the session. Inpatient might not be the best term for that. What I mean is in an outpatient clinical context.
Monitored. Yeah.
So, and then given like two sessions of MDMA therapy and an additional booster had better outcomes than those who received a placebo back in a 2010 study, because that's how long this has been given. So MDMA had better effect sizes and lower dropout rates when compared to paroxetine and sertraline. And I mean, that's pretty massive to have lower dropout rates. And the U.S. Food and Drug Administration granted MDMA breakthrough therapy status for treatment of PTSD. So, I mean, that's what that means, is that this can be studied and doctors are using it. I have a high level of hope for that. I mean, what I just quoted from was from 2019, breakthrough for trauma treatment, safety, and efficacy of MDMA-assisted psychotherapy compared to paroxetine and sertraline, which the article.
So do they get, so basically they give a dose of MDMA, and then do you process trauma while under the influence of the medication? Or does it just kind of, like you said, calm down the amygdala, which causes so many of the symptoms of PTSD?
So yeah, okay. So something like esketamine, the Spravato treatment, which is a nasal spray, I think is given outpatient, and it's typically done where you're monitored, but I don't know that you actively are guided through therapy.
Gotcha.
Okay. So but some of these are given and you are walked through with therapy. So ketamine assisted therapy is also a thing where you're walked through with the therapeutic experience of like talking about what happened, and it's blunted. There's a desensitization effect. So that's a big thing. Is that desensitizing, similar to EMDR, but obviously very different mechanism there, potentially. So
fascinating.
yeah. And honestly, as I learn more about this, and okay, patients underwent several 90-minute non-drug psychotherapy sessions before and after low doses of MDMA. Interesting. So that was what was done early on from 2000 to 2002. And so there we've got the psychotherapy occurring before and after.
Right.
A lot of this, I think, is being standardized now, whereas I think in the future it'll be even more standard, like a protocol.
I agree. And I think that your point is valid when you say, you need to be under a reputable doctor who does this, because there are, like when you look into psychedelic stuff, the active ingredient and mushrooms and some other plant medicines where you literally go to a medicine man, in Utah somewhere, and they give you this tea, and you kind of go to this really dark place. I follow a guy on Instagram that did it, and Aaron Rodgers, now with the New York Jets, he went on that. He called it his something of darkness. I can't remember what it was, but I would encourage listeners to go to a medical professional, because while those, out in the middle of Utah in the middle of the night with plant medicine men giving you stuff that you don't know how you're going to respond to, and taking you to a place without a professional there is not recommendable. I don't think you need to have letters behind your name for that. But I do think it's fascinating, and by way of what we try to do here, Jeremy, is that it does provide hope for people. I love the yellow warning flag with cannabis, because that is becoming pretty hot. I would encourage listeners out there who do choose to use cannabis to help with their PTSD or anything else to make sure you're legally doing that. And if you live in a state like I do, there are dispensaries where you know where it comes from, and it's not laced with something, and all of those things. But I think that those yellow flag moments that you mentioned with cannabis are very real for PTSD. I'm fascinated by using MDMA and ketamine. It's absolutely fascinating to me.
So Spravato is an esketamine spray, and that's given outpatient. MDMA is not. MDMA is given in trials now, and it is given with psychotherapy. So these are very carefully controlled trials. Ketamine is actually done now way more widespread, and you can see the ketamine treatment clinics.
I see that at the hospital.
Yeah, and we're seeing some positive results for that in the treatment of depression. And again, it's something that people may respond differently. Some people really respond well to the ketamine infusions, meaning the IV. Some respond well to the nasal spray. We're still figuring that out, but it helps to desensitize the response to traumatic intrusions. And so that's
and not to get too sciencey, but guys, look up the amygdala, Google that, and you will understand why it rules you. It is like Jeremy calls it the fear center, but it is the place where all the things are dumped, and with anxiety and all, and people in trauma often have that organ is actually smaller and a little bit shrunken than someone who does not have PTSD. But I will also give you hope with that, is that that same MRI showed my amygdala growing. And so it was shriveled. We did 6 months of EMDR, and it just kind of, YouTube, actually we're only on YouTube, but it just kind of opened up a little bit. And so I think what some of these treatments are doing is targeting that amygdala and then desensitizing you to it, very similar to EMDR. EMDR is probably cheaper and a way better way to go if it works for you, is to desensitize that memory. But it sounds like they get you to a place that's safe and to a place that's manageable in terms of emotional pain. And then there's all those chemical things going on in the amygdala, which and we won't even bore you with all the neuroscience of especially EMDR. So, all right, Jeremy. Well, hopefully people listen to the episode that is back. We put this as a YouTube exclusive for alternative treatments, and so thank you for being here today. I appreciate it, and I know that my listeners do as well.
Awesome. Thank you very much.
All right. If you want to have any information on Jeremy Fox, his information is in the show notes. Fantastic follow on Instagram. Jeremy is a professional therapist, but takes a lot of his time just in true altruistic efforts to help people like he has done here today. And so you can follow him on Instagram at what Jeremy Fox says, but it'll also be in the show notes. And so until next time, you guys have a great one.
Here I am, you can see that I'm nowhere